Reflux Hour. Today, as other days, I'm going to talk on a topic for approximately 15 minutes, and I'm going to try to answer questions. This is Dr. Jamie Koufman. This is Dr. Koufman's Acid Reflux Hour. My video is acting strange. I want to talk about food today because I get questions about food. I get questions about individual foods. I get questions about chocolate. I get questions about wine. I get questions about a variety of different foods, including meats, vegetables, fruits, and so on. So I want to talk about that. I want to talk about keto slightly, but I'm actually doing a blog on keto diet, the keto diet, next week, and I want to also do one on other types of diets that are now in fad. So anyway, that's coming. I also am thinking about doing a two-part series, a longer YouTube on the history of respiratory reflux. It started for me in 1981, and it's been sort of my life's work all that time. So in any case, I'd like to talk about food, but before I do, I want to say a couple of things. People say to me things like, I have mild detox, what should I do? It wasn't that long ago I saw a man who came to me with postnasal drip, and when I examined him, he had about the worst looking throat I've seen. I saw that year perhaps. And he clearly had findings of snoring and sleep apnea. So just because the symptoms are mild doesn't mean you don't have the whole tamale, or at least the whole tamale brewing. So the message with that is everyone should do a detox. The idea is not to get your reflux better, but to get your reflux gone. And so you need to know, and I tell people this all the time, for most people, reflux is not a medical problem. And what do I mean? There's no pill, there's no procedure, there's no doctor that's going to make your reflux go away. For 95% of the population, it's about diet and lifestyle. So I wrote about Chegan last week. Chegan is a cheating vegan. I made up this word. I was vegan for 4 years, coming off of being quite heavy and being a sugar addict. And, you know, the way you lose weight is reduce your calories. I don't care what you need to reduce them to. The pills don't really help in the long run. I'm not a fan of the surgery. I'm a fan of the truth. We spend $1 trillion a year to get sick, okay? 30% of the American diet is fast food, and we spend $1 trillion on procedures that don't work. And that's all of them, the magnets, the links, the strata, I don't know what there's questions about some of the other ones. But the first question I'm going to address is related, and it's very important to address. It says, I'd like to know why, and this is a question from Lana. And I'm going to address this one now because I think it's part of my topic. I'd like to know why Nissen fundoplication surgery often fails and has no effect on respiratory reflux symptoms in many cases. Now, there's two reasons why it fails. One reason is that the surgeon did not do a complete 360-degree wrap. A partial wrap or 270-degree wrap or a toupee wrap is useless for patients who have respiratory reflux. But I'm going to tell this story over and over and over again. I had a lovely woman from the Upper East Side, had surgery by the best surgeon I know 4 years prior, and she consulted me this year. And she was refluxing terribly. She had every symptom. She had the cough. She had the mucus. She was very, very miserable, in fact. And first question, I said, what time do you eat dinner? She said, 8 o'clock. I said, what time do you go to bed? She said, 10 o'clock. And I said, you have a 100% chance of refluxing every night. And you're never going to eat after 5 o'clock for the rest of your life, I said to this 75-year-old woman, if you want to not have these symptoms. So the surgery wasn't bad. The surgery was still intact, but it was stiff and swollen, this big wrap, just like the little valve had been before. And if it's stiff and it's swollen, it's inflamed, even a wrap won't work. So if the best surgery by the best surgeon doesn't work, then it really comes down to diet and lifestyle. So you cannot have your cake and eat it too. I haven't been to a fast food restaurant since 1980 something. 30% of American diet is fast food. So first question about food. You cannot go to a fast food restaurant. And the next, I have a question in here. If I go to a fast food restaurant, what should I get? And the answer is a glass of water. Even the dressing on the salad is so high fat. So you can't, fast food is gone. You're going to have to be more creative in how you take care of. For me, I carried a backpack full of food on Monday to my office, and we closed the office from 12:30 to 1:30, and we had, that was the big meal, the entree, the potato, the salad, the whole deal. So if you like having dinner parties at 8:30 on a Saturday night, you're going to have reflux, and so is everyone else. If your summer comes, it's getting longer days, you finish soccer practice with your 9-year-old at 8 o'clock at night and you stop at McDonald's to eat, you're all going to have reflux. So the high-fat food, and that gets me to my question about keto. Keto is a high-fat diet. Fat makes two parts of what I do. Fat makes the lower esophageal sphincter relax. So low-fat diet, moderate low-fat diet. And low-acid diet because of the activation of pepsin. So those are the two keys, low acid and low fat, and not eating too late, not lying down after you eat, and if you can, sleep on an incline if you have reflux. So when you get to talking about foods, and I get back to this question of Chigan, I was heavy, and I decided I'd go vegan. This is before vegan was even a common term, I think. And I did it for 4 years. And it's hard to get enough protein. Figure you need 1,800 calories a day, roughly. Women, maybe less, men maybe more. And about 45 grams of protein. And if you look at a cup of broccoli, I think it only has 3 grams of protein. So I looked at my cupboard, I discovered I love sardines, not everybody does. I looked at the can, and there were 26 grams of protein in a sardine. It's half of the day's needed allowance. So the reason why I went Chigan is I cook a lot of Asian, I cook with a lot of rice, I cook with a lot of beans, a lot of lentils, I cook a lot of things that are basically whole pot meals in my rice maker, because that's what I like, and it's fulfilling and filling as well. I mean, I have enough calories. I've been the same weight now for 20-something years, the same size. And so my weight is stable. It's interesting because I'm now 76. If I have a very bad back and I like to lie down a lot, particularly in the evening. If I eat dinner and I lie down too soon, I will have reflux. So I have to fight it. The Chigan diet is really sort of the way to go. And yeah, okay. I eat fish. I eat a lot of fish. I take 2 salmon fillets. I get them frozen, West Coast sockeye, and I do them in a pan. And then I can use them in other things. I can use salmon on a Caesar salad. I can use salmon diced up in part of a breakfast cereal, egg white. You'll see it on my breakfast post. So the questions of specific foods, they're all on my blog. If you type in chocolate, you're going to get an article about chocolate. Chocolate has high fat and has something called theobromine, makes the lower esophageal sphincter relax. Obviously, what I'm saying to you is when the lower esophageal sphincter relaxes, you have reflux. And by the way, this question is asked all the time, burping is reflux. It's just aerosolized. Not a lot of fluid came up. So the Chigan diet works for me, and it works for a lot of people that I know who are interested in eating healthy. My cholesterol is low, my coronary arteries are clean, and I used to be on high blood pressure medicine. I used to be on cholesterol medicine, no longer. So I'm stuck with the concept, which I tell people. By the way, when I do consultations, I do virtual consultations, and I can tell you the majority of people who do consultations have not been to my blog first. So please, jamiekoufman.com. Everything I've written since the first of the year applies to you. So Chigan is the way to go, in my opinion. That said, if you have reflux, you need to do a detox. Write in detox, reflux detox, and that'll come up. And so I don't want to talk about the individual foods. And the reason is the hardest part about treating reflux is everybody's different. So, I had a really strange trigger food, cucumber. And I used to have a cucumber as a snack while I was cooking so I wouldn't be hungry, still be hungry for dinner. And I have reflux. And I don't know anyone else who's ever had cucumber. Same thing, you can even have cucumber rare, oatmeal, and so on. So everybody's different. And so after you do your detox program, what you're going to need to do is you're going to need to change variables slowly. Even though the detox program is 4 weeks, you can't change everything back at the end of 4 weeks. That said, I do have people, particularly New Yorkers, who are out in the world. They do a detox program, they get well, they stabilize everything, they figure out what their important variables are. Okay, so if they're out a little late, they take, and this is 2 years later, they take a famotidine before they go to bed. They take Gaviscon. They have a bed that goes up and down. They sleep on a high incline, and they try to stay up as long as they can. If you eat within 3 hours for sure, you're going to have reflux. And now we're talking silent nighttime respiratory reflux, and that's the problem. You don't wake up with it most of the time. Some people do wake up coughing. It's not COPD, it's reflux. It's quiet during the night for most people, and during the day you don't have heartburn or indigestion. So America has respiratory reflux. And by the way, I'm going to answer the second question, which I think is hysterical. The way it was, Sue, thank you for asking me this. Is living with GERD the new normal? Now, that question is loaded. First of all, in my opinion, the word GERD ought to go away. It can't be a wastebasket for reflux. The gastroenterologist came up with that term in the 70s. I came up with LPR in the 80s, and LPR is not a good term, and GERD isn't a good term. So what's going to survive, in my opinion, is respiratory reflux in the respiratory system. What about the ears and the sinuses? There are questions today. And this is esophageal reflux, and some people have esophageal reflux and respiratory reflux. So that keeps it clean. And furthermore, it's not just acid reflux, it's really peptic reflux. Remember, if you don't know what pepsin is, one of your first articles you ought to read on my blog is What is Pepsin? So that's pretty much all I want to say about foods. You are what you eat. If you have reflux and you have pepsin hanging around in your throat and you have any kind of soft drink, by law they're all acidified to at least below pH 4. But nobody ever told the manufacturer 2.9 is fine. But 2.9 is the same strength, if you will, of acidity as stomach acid. So when we get back to this question of foods, nothing out of a bottle or a can, unless you make it. Even aloe vera. Someone asked me about aloe vera. If it came in a can or it came in a bottle, and then it says, enhanced with vitamin C added, that's acidic, that's ascorbic acid. And that's done so that it gets below pH 4. So I drink nothing out of a bottle or a can. I drink water and I drink tea. I'm a big tea drinker. I get up in the morning and I have English breakfast tea that has caffeine, and then I go on to different ones. I have one with turmeric, and then I go on to chamomile. So I'd like to start answering these questions and go back and answer it cleanly. So it's not the fundoplication. It's either you had the wrong surgery, the partial wrap, or like the lady who was eating at 8 and going to bed at 10, you can make your big swollen new valve wrap just as swollen and ineffective as the original one. So reflux is about diet and lifestyle. And I had a guy who came to me very, very angry. He was a Wall Streeter. His thing was to go out to a steakhouse at 9 o'clock and essentially drink too much, and didn't matter his surgery. So he had the surgery and was mad after. Now, I want to answer these questions, and I don't know if I'm going to go long or not, because I really would like to address them. They're a good group. The first one is, what are your thoughts on reflux? It says LPR being associated with subglottic stenosis. I've been fighting my own colleagues. I presented my magnum opus in 1991 And it was the most quoted article in otolaryngology for a decade. And one of the groups we studied was subglottic stenosis. And we had real reflux testing. We put a high quality a pH device in the throat 24 hours. The cause of subglottic stenosis is reflux. So if you have subglottic stenosis, you need to be on a strict diet, you need to have a bed that goes up and stay up, and you need to have surgery, you need to do everything. Because that's airway obstruction, and you don't want to live like that and have that to be reopened and reopened. From a surgical point of view, most of you forget I was a surgeon. That should have radial cuts and dilation, just radial cuts and dilation. And then you should be on the strictest protocol of all. I mean, you ought to finish eating at 4 o'clock. You ought to sleep at 45 degrees, but you shouldn't take PPIs. So PPIs are, in Jamie Koufman world, non-existent, ineffective medications with a lot of side effects. So let's not talk about PPIs today. I will tell you, I've written about PPIs 3 times on my blog, but this next blog after the keto, I'm probably going to do how do you taper. I'm going to talk about it today, but how do you taper off the PPI? Because it's complicated. There's no such thing as cutting them in half or having one every other day. So without further ado, how do I taper off H2A? So the ones that I recommend are basically famotidine and cimetidine. Those are the chemical or generic names, and that's the pepsin and Tagamet. Those are the 2 popular, available almost in every single pharmacy. The dose should be 20 milligrams, and it should be breakfast before dinner and 2 before bed. The 2 before bed are 40 milligrams. The same thing with the cimetidine, and the 2 before bed are very, very effective, better than PPI for nighttime reflux. But how do you taper off them? Well, you don't have any reflux. Your postnasal drip is gone. Your throat clearing is gone. Your globus is gone. Your hoarseness and raspiness of your voice is gone. The shortness of breath is gone. Your diet is clean. You know that you're living it right. So the way I recommend tapering medications is drop 1 dose every 2 weeks or a month. So you go from 4 to 3 to 2, and with leaving the ones before bed for last. So the first month you'll drop the lunch one perhaps. The one before dinner. And the second month you'll drop the morning one. And the third month you'll drop one of the evening before bed ones, and then finally. But once you're off it, you should still carry them with you. You're going to have the night that's compromised. So you know you're eating a little late. Take 1 before you eat. Take 2. You've not been on medicine for 6 months. And take 2 before you go to bed and sleep on an incline. So you're always going to, and take some Gaviscon. I've written an article, a post on the alginates, and I really like it because the picture of the seaweed is very cool. But it's an interesting blog. So I want to again appeal to everybody that many of the questions that I'm being asked I've answered. I've been writing this blog pretty much for people who do consults with me. So there's an article on chewing gum. Okay, there's an article on alcohol and water recently that sort of covers the groundwork and puts all the pieces together. So read the blog. I'm going to do more on YouTube because some people don't like to read. But meanwhile, it's on the blog. Tell your friends about the blog. We're getting 1 million hits a month, and I will not be happy until we have 1 million hits a day. There's no other content being put on the internet that's comparable to what I'm putting on. And it's basically 40 years of experience with the best reflux testing technology. So I'm going to say a few words about tapering, proton pump inhibitors, PPIs. So those are the not famotidine and not cimetidine. We're talking everything from Prilosec, omeprazole, pantoprazole, esomeprazole. It goes on. I think there are 14 of them now. And they're all sold over the counter or they're prescribed. They are bad pills. 100% of people, 0% of people are cured by PPIs. It makes any symptoms better. Big Band-Aid, okay? A lot of symptoms that are really funny. Had a guy with a bellyache. I went to the ER, had $100,000 worth of tests came to me, and I said, stop taking the Prilosec. And that was the end of his abdominal pain. So the question is, how do you taper? I don't want anyone on so this is what you do. Let's pretend you're on two. You're on one in the morning and one in the evening. So the first thing you're going to do is you're going to go buy the things that I recommended, but more. You're going to buy the famotidine. You're going to order the Gaviscon. Go on the alginate thing. Just click right to it's Gaviscon Advanced Aniseed. In my opinion, it's the best and it's the cheapest. And you'll see, and it comes in a bottle, a big bottle. It looks like that. And I don't get any money from anything. I've never had any relationship with any company. So understand that I'm recommending the pills, and then the alginate, and you probably ought to buy some antacids, something like Malox, Gelusil, and a bunch of Tums and Rolaids. Now, while you're there, buy some chewing gum. People ask me, what kind of gum do I like? Any gum that doesn't have spearmint, but bubble gum and juicy fruit and those, the flavor's gone too soon. So when I was chewing gum, and cinnamon's okay. Cinnamon without any sugar is what I chewed. And so if you have rebound means that after you stop your PPI, you get terrible heartburn and terrible reflux, worse than it ever was before. And that's why they tell you to take them for 2 weeks. You take them for 2 weeks, and you feel better, then you stop and you get rebound. And by the way, only about a third of people have rebound. And Gaviscon doesn't increase blood pressure unless you're salt restricted. But if you don't eat other salt and other things, the amount of salt in a belt of Gaviscon before bed, which is the most important time, is not going to have any effect. So even on salt-restricted diets. So the first thing I would stop is the evening one. I let people take the morning one. So you're taking the morning Prilosec, and you're taking, let's just say, call it pepsin, before lunch, before dinner, and 2 before bed. And you do that for a week, and you see where you are in the rebound. But the second week, you got to drop the second one, or if you're only on one, you drop it. And now you're on the famotidine, now you're on the Gaviscon, now you're on eating earlier, being upright, and so on. So I'm not going to go through all the treatment, but I am going to tell you that chewing gum after a meal, you make more saliva, more salivate bicarbonate, and you swallow more. We put lozenges and cough drops, Ricola, in Carnegie Hall, because people always gone out to dinner and had an alcohol and wanted to clear the throat or cough. But when you're sucking on a hard candy or chewing gum, you don't. And so all of these pieces go together. And if you look at the detox program, you look at the article on alginate, if you look at that, all of those pieces plus antacids and something like Tums and Rolaids, those will get you through rebound. Rebound lasts from 2 to 8 weeks, and it doesn't appear to matter how long you were on it. I've had one person who was on it for 5 days and got rebound when they came off, and that's the only one like that I can recall. And if you've been on it for years, you should know long-term use of PPIs increases your risk of esophageal cancer. So I've got now 3 blogs on the PPIs, and I'm going to talk more about it in this next one, how to, in detail, rebound hyperacidity and how to taper off PPIs. Like many, I breathe through my mouth when sleeping. I do not snore. They say gentle mouth taping helps reduce the acid reflux. Does mouth taping reduce because you breathe through your nose? The answer is no. Mouth taping does not do that. God, I don't know why anyone do mouth taping. It's got to be disruptive to your sleep. Someone had a transnasal esophagoscopy by a friend of mine in Washington, Steve Balamowicz, and it was pristine. And how often should I get a TNA? And the answer is, I don't know, 10 or 15 years from now. Especially if your reflux is under control, completely never. Okay, if it was normal when you had reflux. So this idea that you have to keep coming back to have endoscopies doesn't make any sense. And the second question is related to that. And by the way, the same applies to GI endoscopy. You shouldn't be doing them over and over and over and over and over. What you're really doing is setting up an annuity or buying a new car for the GI's wife. should a second barium swallow, and by the way, barium swallow turns out to be better, and your family doctor can order a barium swallow. Barium swallow esophagram. You swallow some chalky stuff, they watch it literally happen in real time. And it should be done upright, standing, and supine, lying down. And if you see reflux or you see dysmotility, no biggie. Dysmotility or having an esophagus, let's just say lazy esophagus, is part and parcel of reflux. You don't need to be on special medicine. Mind your reflux, mind your diet, and you don't need another one. If you go through detox and everything clears up and you're still refluxing and you've done everything right, I mean everything right, all the pieces, 7 pieces, then maybe you should get another barium swallow. Do shaker exercises help? They are absolute. The word we use here is medical bullshit. Okay? None of these devices, someone asked me about one from Sweden, even the magnet thing doesn't work, the endocinch doesn't work, none of these things work. So for at least half of my patients who come to me have had these procedures. And it's all about diet and lifestyle. So yeah, the thing that you strap on your neck is ridiculous. Now, this is a very interesting question. Does pepsin linger in your nostrils or other areas, even if you've managed to reduce it with alkaline water? So this is a very naive question. The assumption is that alkaline water and alkaline water spray, by the way, if you haven't seen these little bottles, you need to go look at my articles on. I'm a singer, okay? And I have reflux. When you swallow alkaline water, the one place you never get is on your vocal cords. They clamp shut, so you don't aspirate. A lot of the singers on Broadway are walking around with these. And it feels good. Now, pepsin dies at 8, and this is my pH 9.5 water. I don't put anything special in it. But meanwhile, that's not a treatment. That's part of a treatment program. So alkaline water and alkaline water spray, remember I said there's 7 parts, and it's all in the detox program. So, and then you have to figure out which of these are most important. In my case, I told you lying down too early after eating is bad. The pepsin lingering thing, by the way, if you have nasal symptoms, the company, when you find the link to these little bottles on Amazon, just put in the same company's name for 2-ounce nose droppers, and when you get up in the morning, you put it in. If it burns when you put in alkaline water, you have really bad reflux. It's a lot of pepsin. Pepsin is gone by itself if you have no reflux for a month. Okay, but the detox program means you're going to stop reflux cold in its tracks for 4 weeks, long enough to let things heal. How do I tell a phlegm in my mouth after waking up in the morning is acidic or not? You can't tell whether it's acidic or not. Too much phlegm is the number one finding and the number one symptom of respiratory reflux. The new term, respiratory reflux. The lining membranes are mucous membranes. So almost everybody, not everybody, has a thick mucus, and it's never allergy. Allergy is thin mucus with itchy eyes and all those kind of symptoms. And when in contact with an allergen, be it a cat or trees pollinating. But this whole idea of getting rid of the pepsin is important, and the phlegm in the mouth is just a symptom of respiratory reflux, chances are, if it's excessive, and especially if it's thick. Can LPR cause pulsatile tinnitus? I have everything serious rule out happens after I eat. Well, I can't answer the question for sure, because a lot of people after they eat have changes, cardiovascular changes. I have what's called POTS, a partial orthostatic tachycardia syndrome. It's a long COVID complication. I've actually written on a post about it, cardiac complications of COVID. So it could be big changes in pressure and things, which do occur in some people. Or it could be reflux. You read the article on ears and you'll see that there's a little place right where your station tubes are where if you have reflux at night, it's going to sit in a puddle if you're lying flat or close to flat. And by the way, these little wedges don't do much. If you really have respiratory reflux, you have to be up higher. I'm going to go through some of these questions quickly. A burning mouth can be made worse by reflux, but it's a neurogenic symptom. If you read my article, there's an article on treatment of neurogenic symptoms, and I treat burning throat. I mean real burning throat, not just a little bit. I mean all day long. I treat voice use pain, real pain with voice use, and I treat neurogenic cough. And honorable mention, I said, goes to burning tongue. So you have to rule out a few things. You need to make sure your B12 is okay and your zinc is okay, because those two things can be low, and they can contribute certainly to burning mouth. 24/7 postnasal drip. Antihistamines don't work. Antihistamines are the last thing you should take because it makes the stuff even drier. So the idea that you don't recognize that this is probably respiratory reflux, there's not a pill that's going to help you, and an antihistamine is going to do the opposite. It's going to make it worse. My GI prescribed the omeprazole. I have 3 fills. Don't take it. Ignore, in my opinion, I think nobody should take PPIs. Get yourself on a program. You may or may not have rebound. Remember, most people don't have rebounds. 1 out of 3. Regarding the burgers causing acid reflux, what would you order in a fast food restaurant? And the answer is nothing. Oh, I answered that before. And all of these questions on this page are people are doing partial things, and they think that they should be fine. And here's a good question. My son has both allergies and respiratory reflux. What should he take for allergies if antihistamines make his reflux worse? My experience with allergies, particularly, they're almost always nasal. I get ragweed in the fall, and I spray. You got to use a steroid spray that goes in the nose. I think a Nasacort, and I can't remember the name of the other one that's over the counter. But you got to spray them, and spray them, say, straight. Don't spray it up. Breathe in, 2 puffs, twice a day, and it's going to take a month before it takes effect. So it's not like a treatment where you have pain and you take a pain medicine. But the steroid treatment can be used at least 6 months of the year, and I recommend for nasal particularly allergies the steroid sprays. Last question I'm going to ask is thoughts on using colloidal silver to spray into the nose for treatment. Huh? I don't even know what it is and what it would be used for. Sure as hell isn't something I would do. I don't know about it. I don't know. And then here's another one trying a Navage system. Here's the last question I'm going to do. Regarding alkaline drops, there's a nice article on alkaline drops. To my surprise, I went and I tested them. They work, or at least most of them work, to make alkaline water in a restaurant. Regarding alkaline drops, can these drops be added to all sorts of drinks, making them more alkaline? The answer is no. Even if you took your Coca-Cola and made it half alkaline water, it would still be more acidic than tall. Remember, the acidity scale is logarithmic. So the questions that are unanswered that I'm gonna leave for next time. I am gonna come back to them. It's interesting to me to see what people are asking. I'm gonna talk about procedures a little more, and I'll answer one more because I've covered most of them. Is there a connection between respiratory reflux and high blood pressure? And the answer is I don't know. Read the articles on the vagus. The vagus runs everything, the cardiovascular system, all of it, blood pressure, heart rate, all of it. And it runs the respiratory and digestive systems as well. So anyway, thank you everybody. I've enjoyed this today, and I hope it's useful to you. And if you have questions, first of all, tell people about the blog. Make sure you're in the blog. Sign up for the blog. Put your email in. Each week you'll get an email telling you the topic. If it interests you, you'll open it. If it doesn't, you'll delete it. And I'm sending them out on Tuesdays. And tell people about it. And if you have somebody who's clearing their throat 24/7, they got respiratory reflux, get them on the blog. And remember, there's also a lot of stuff on YouTube now. Bye.